I'm Sydney Neely, and it's time for The Shortcut. Joining me on tonight's show is Dr. Daniel Vaena. He's the medical oncologist and director of Phase 1 clinical research at West Cancer Center and Research Institute. He specializes in testicular cancer and is here to talk about signs, symptoms, treatment options, and more about this area of healthcare. Hi, Dr. Vaena.
Hello, how are you? Happy to be here. Thank you.
Thank you for joining us. So April is Testicular Cancer Awareness Month, and obviously it's specific to men, but how common is it? And is it more common in specific groups of people like age or racial groups?
Yeah, it's one of the important cancers because there's a very effective treatment for that. It's not very common. It's one of the more rare cancers. It's about 8,000 cases a year in the U.S., 8 to 9,000 cases a year. It's a little bit more common in white males. The incidence has been increasing in African Americans as well, but it's a little bit more common in white males. But it's a rare cancer. It's one of the rarest cancers, but one of the most curable cancers as well.
And what are some signs and symptoms our viewers can be mindful of that may be indicative of a testicular cancer diagnosis?
So the main sign or symptom would be enlarged testicle or enlarged scrotum or scrotal swelling. In any young man with persistent back pain, this would be a diagnosis that we always would also think about if there's persistent back pain.
And at West Cancer Center, you guys work heavily in the realm of research regarding new treatment. Are there any updates in the realm of testicular cancer that you can share with us?
So the good news about testicular cancer, we've had very high cure rates for a long time. There's very effective treatment for that, either when it's localized, when patients get surgery, or when it's widespread, when patients get chemotherapy. But there's ongoing advances and research studies being done in terms of how to detect patients who had surgery who may be at higher risk of relapse. And then the other research that's ongoing is for patients who have relapsed, who have more advanced disease, and how we can improve those treatments, especially if they relapse after chemotherapy. But for initial treatment, for initial surgery or initial chemotherapy, the success rate is very high. So we've been very fortunate to have this cancer be easily treatable in that regard.
Thank you so much, Dr. Vaena, for joining us on The Shortcut and sharing your expertise with us. For more information, you all can visit westcancercenter.com. That's all the time that we have for tonight's show. I'm Sydney Neely, and I'll catch you next time on The Shortcut.